Hi! In this health and wellness video, we are going to talk about the causes and symptoms of the chronic disease called diabetes. So, before starting this video, please like this video and subscribe to this channel for our future updates. Diabetes mellitus, commonly referred to as diabetes, is a chronic disorder. It occurs when the pancreas does not secrete enough insulin or when the cells of the body become resistant to insulin. In either case, the blood sugar cannot get into the cells for storage, which then leads to serious complications. Diabetes, perhaps more than any other disease, is strongly associated with the Western diet, as it was uncommon in cultures consuming a primitive diet. However, as cultures switch from their native diets to the foods of commerce, their rate of diabetes increases, eventually reaching the proportions seen in the Western societies. Before we have a tendency to begin, why don't you hit the subscribe button? And therefore, the bell notification icon, thus you never miss any of our health and wellness videos. Let's begin. High blood sugar is a modern-day metabolic disorder. There are over 33 million people with diabetes and over 80 million diagnosed with prediabetes in the USA alone, according to the World Health Organization. The number of people with diabetes rose from 108 million in 1980 to 422 million in 2014. The global prevalence of diabetes among adults over 18 years of age rose from 4.7% in 1980 to 8.5% in 2014. Between 2000 and 2016, there was a 5% increase in premature mortality from diabetes. Diabetes prevalence has been rising more rapidly in low and middle-income countries than in high-income countries. Diabetes is a major cause of blindness, kidney failure, heart attacks, stroke and lower limb amputation. In 2016, an estimated 1.6 million deaths were directly caused by diabetes. Another 2.2 million deaths were attributable to high blood glucose in 2012. Almost half of all deaths attributable to high blood glucose occur before the age of 70 years. World Health Organization estimates that diabetes was the 7th leading cause of death in 2016. A healthy diet, regular physical activity, maintaining a normal body weight and avoiding tobacco use are ways to prevent or delay the onset of type 2 diabetes. Diabetes can be treated and its consequences avoided or delayed with diet, physical activity, medication and regular screening and treatment for complications. The IDF Diabetes Atlas 9th edition 2019 provides the latest figures, information and projections on diabetes worldwide. In 2019, approximately 463 million adults, 20 to 79 years, were living with diabetes. By 2045, this will rise to 700 million. The proportion of people with type 2 diabetes is increasing in most countries. 79% of adults with diabetes were living in low and middle income countries. 1 in 5 of the people who are above 65 years old have diabetes. 1 in 232 million people with diabetes were undiagnosed. Diabetes caused 4.2 million deaths. Diabetes caused at least $760 billion in health expenditure in 2019, 10% of total spending on adults. More than 1.1 million children and adolescents are living with type 1 diabetes. More than 20 million live births, 1 in 6 live births, are affected by diabetes during pregnancy. 374 million people are at increased risk of developing type 2 diabetes. Insulin is a hormone that regulates blood sugar in the body. Diabetes is a chronic disease that occurs in the body either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces, thus causing a raise in blood sugar level, hyperglycemia, which over time leads to complication and an increased risk of developing a number of serious health problems. Consistently high blood glucose levels in the body can lead to serious diseases which will affect the heart and blood vessels, eyes, kidneys, nerves and teeth. In almost all high-income countries where people are living in modern lifestyle, diabetes is a leading cause of cardiovascular disease, blindness, kidney failure, and lower limb amputation. People with diabetes also have a higher risk of developing infections. Maintaining healthy blood glucose levels, Regular physical activity, which includes a combination of both aerobic, example, jogging, swimming, cycling, exercise and resistance training. Healthy diet includes reducing the amount of calories for overweight people, replacing saturated fats, example, cream, cheese, butter, etc. with unsaturated fats, like avocado, nuts, olive and vegetable oils. Increase dietary fiber intake like fruits, vegetables, whole grains, etc. and avoiding tobacco use, excessive alcohol and added sugar. Type 1 diabetes. About 10% of all people with diabetes have type 1 diabetes. This is when the pancreas does not produce enough insulin, causing insulin production deficiency in the body. People with type 1 diabetes will require daily administration of insulin. Type 1 diabetes can affect people at any age, but usually develops in children or young adults. People with type 1 diabetes need daily injections of insulin to control their blood glucose levels. If people with type 1 diabetes do not have access to insulin, they will die. The following are some of the most common symptoms of type 1 diabetes: abnormal thirst and dry mouth, sudden weight loss, frequent urination, lack of energy, tiredness, constant hunger, blurred vision, bedwetting. Type 2 diabetes. This is the most common type of diabetes. About 90% of all people with diabetes have type 2 diabetes. This is when the body is not able to utilize and use insulin effectively or insulin resistance, where the body does not fully respond to insulin to maintain healthy blood glucose levels. For some cases, this can eventually exhaust the pancreas, resulting in the body producing less and less insulin, causing hyperglycemia, and even higher blood sugar levels. Type 2 diabetes is most commonly diagnosed in older adults, but is increasingly seen in children, adolescents and younger adults due to rising levels of obesity, physical inactivity and poor diet. The following are some of the most common symptoms of type 2 diabetes: excessive thirst and dry mouth, frequent urination, lack of energy, tiredness, slow healing wounds, recurrent infections in the skin, blurred vision, tingling or numbness in hands and feet. These symptoms can be mild or absent, and so people with type 2 diabetes may live several years with the condition before being diagnosed. It is advisable to maintain a healthy diet, increased physical activity and a healthy body weight in order to avoid type 2 diabetes, which may be diagnosed several years after complications have already arisen. Precaution is always better than cure. Gestational diabetes. Gestational diabetes is hyperglycemia with blood glucose values above normal but below those diagnostic of diabetes. Gestational diabetes occurs during pregnancy. Women with gestational diabetes are at an increased risk of complications during pregnancy and at delivery. These women and possibly their children are also at increased risk of type 2 diabetes in the future. Gestational diabetes is diagnosed through prenatal screening, rather than through reported symptoms. Impaired glucose tolerance and impaired fasting glycemia. Impaired glucose tolerance (IGT) and impaired fasting glycemia (IFG) are intermediate conditions in the transition between normality and diabetes. People with IGT or IFG are at high risk of progressing to type 2 diabetes, although this is not inevitable. These symptoms may occur suddenly. Symptoms are as follows: excessive excretion of urine, polyuria, thirst, polydipsia, constant hunger, weight loss, vision changes, and fatigue. Health impact and diabetes complications. In the long run, diabetes can cause damage to the eyes, kidneys, the heart, blood vessels and nerves. The damage of blood vessels and nerves, neuropathy, in the feet leads to reduced blood flow, causing foot ulcers and infection, which eventually lead to the need for limb amputation. Adults, especially with diabetes, have a 2 to 3-fold increased risk of heart attacks and strokes. Diabetes is the cause of 2.6% of global blindness. Diabetic retinopathy is the result of prolonged accumulated damage of small blood vessels in the retina of the eyes, causing eyesight problems. Diabetes is also among the leading causes of kidney failure. Healthy nutrition and physical activity help reduce the risk of diabetes. Maintaining healthy blood glucose levels through regular physical activity, which includes a combination of both aerobic, example, jogging, swimming, cycling, cycling, exercise and resistance training. Healthy diet includes reducing the amount of calories for overweight people, replacing saturated fats, example, cream, cheese, butter, etc. with unsaturated fats, example, avocado, nuts, olive and vegetable oils. Increase dietary fiber intake like fruits, vegetables, whole grains, etc., and avoiding tobacco use, excessive alcohol and added sugar. Thus, living a healthy lifestyle of good nutrition and physical activity, we may eliminate the risk of diabetes. That's all for today. Always remember this. You are born to win. Engineer for success, destined to be somebody great in life. All things are possible in life. You are born to be a winner. May God bless you with great success, wealth, health and prosperity all the days of your life. Remember to subscribe. Click on the subscribe button and the notification bell. Thanks for watching.